If you've been researching OCD treatment, you've probably seen a bunch of acronyms and have no idea what they mean. So let's break down the top three. I'm Dr. Melissa Germain, a licensed clinical psychologist specializing in OCD and anxiety. If you've come across ERP, ACT, and ICBT, you're not alone in feeling confused by the differences. My foundational OCD training was in ERP and ACT. I love combining the two. It's my jam. And I'll be honest, I used to be pretty opposed to ICBT because there was a common misconception that it's just reassurance. But I like to practice what I preach and keep a flexible mindset. So I went through a formal ICBT training and it completely shifted for me. It helped me understand the reasoning process behind OCD and how it can be really helpful for people who aren't ready to engage in exposure work or it hasn't worked for them. So now I give my clients options and help them pick the best fit. So let's break down the top three. ERP stands for exposure and response prevention. This means that you intentionally approach situations, thoughts, images, or sensations that are triggering. And this can be in real life. It can also be creative exposures in session, like scripts or narratives. And while you're doing this, afterward, you're practicing not engaging in compulsions, like checking or mental reviewing. And over time, this retrains your brain to learn that discomfort can rise and fall on its own and that you can tolerate it without needing to seek relief. ACT, or some people say ACT, stands for Acceptance and Commitment Therapy. This focuses on changing your relationship to your internal experiences through skills like diffusion, mindfulness, and values work. You learn to notice thoughts as mental events, emotions as something to be noticed, not feared, and then how to create distance from these internal experiences so you can take action and connect to your values. ICBT stands for Inference-Based CBT. This focuses on the reasoning process behind OCD, which they call inferential confusion. It helps you notice when your mind moves away from what you can directly observe in the here and now into the imagine what if OCD stories. And it teaches you how to reconnect with your senses, your real self, and common sense reasoning instead of getting pulled into that OCD sequence. Let's be clear, an ICBT therapist is never reassuring their client about their obsessions, but instead helping them leave the OCD bubble, come back to reality, and choose to trust themselves. Remember, it's not about finding the right treatment. We do not want to treatment hop trying to get rid of OCD because that can be compulsive. It's about understanding that you have options and that you can choose the approach that works for you with the help of an OCD specialist. It's about choosing to commit to the treatment, trusting it, and fully engaging with 2 feet in.